We're going to start with the non-selective NSAIDs, and aspirin, very common drug, is also known as salicylic acid or acetyl salicylic acid. We'll be talking about salicylic acid and salicylates further on in other chapters as well. Phenylbutazone is pretty much an equine drug, and it is known as bute. That's the shorthand name for it. Um, and although your book says don't confuse that with butorphanol, I would tell you that I don't think I've ever heard anybody say, I'm going to go get some bute, meaning butorphanol. So I would, if you're in the large animal world, there you're probably going to just call phenylbutazone bute. And if it's butorphanol, it's going to be referred to as butorphanol. But just be aware of that, make sure you clarify if there's any doubt in your mind. Flunixin meglumine is a drug that's used in the livestock world. We do have a use for it in small animals too. Its trade name is Banamine. And then we have diclofenac sodium, which is known as Surpass. It's a topical NSAID used for horses. And I'm going to bring these up. I'm going to talk about the drugs I've previously mentioned here in more detail, but I'm not going to talk about these so much, these human drugs. But I'm going to mention them because ibuprofen, otherwise known as Advil, and Motrin, and naproxen, otherwise known as Aleve, are used in the human world, and people will sometimes reach for these drugs for their animals, thinking that it's good enough for me. I should just use a smaller dose for my dog. And so if you hear anything like that, or if you just want to make an owner aware of the fact that you're giving a veterinary product that's superior to these drugs, the thing that happens with ibuprofen and naproxen is a GI tract bleeding can occur within a few days. And that upset, the owners will experience it as the dog throwing up or having diarrhea. So it occurs in those first few days. That's why we don't use these drugs in animals. So aspirin. Aspirin, we don't use it a lot because, as I've mentioned, we have superior drugs to this. There's been studies that have shown that one dose of aspirin in some dogs will lead to bleeding, gastrointestinal bleeding. There are a couple of uses that we have for aspirin in small animals and also in horses. The small animal uses relate to a unique property of aspirin among the NSAIDs, so other NSAIDs don't seem to have this property, which is to decrease platelet aggregation. And that basically means that it interferes with clotting. Now, not to the extent that an animal is going to bleed out if they're on aspirin, but it will decrease clot formation in certain circumstances. So one of the uses is for an adjunct therapy to heartworm treatment to prevent blood clots. So anything that causes turbulence in the heart can lead to blood clot formation. It's known as thromboembolism, and it can go to those clots can go to certain areas in the body and cause problems, decrease blood flow to them, block circulation. We think about in humans, we think about low dose aspirin therapy to prevent clots in people who tend to have had strokes or have stroke as a family history. So we don't see strokes so much in animals, but we do see other problems with blood clots going to parts of the body. And so in the case of heartworm treatment, there's other treatment that we do to kill the worms, but to prevent blood clotting, we will use adjunct aspirin therapy. In cats, cats tend to have a condition called hypertrophic cardiomyopathy, or that's one of the cardiac diseases that occurs in cats. It's not a huge problem, but it is there. And so when we are treating that, we can use aspirin therapy as well, because again, we get turbulence in the heart with this disease. And The thing that sometimes brings the owners in and this disease is discovered is something called a saddle thrombus. And what that is a thrombi that has lodged in the aorta where there's the bifurcation to the hind limbs. So where the femoral arteries come off of the aorta, there will be a clot that lodges there, and it basically decreases blood flow to the hind limbs. The cat comes in with not able to walk and has cool to the touch limbs because circulation has been cut off to the limbs. So we can use it to treat and help prevent blood clots in that situation as well. Horses are also sometimes treated with aspirin, and the treatment is for uveitis. Uveitis is a condition, an inflammatory condition of the anterior uveal chamber, which is basically the area behind the cornea and in front of the iris in the eye. And horses and cats are also susceptible to uveitis, and it can lead to blindness. In horses, we will treat sometimes with aspirin. So the side effects are what we've been talking about with NSAIDs. So GI toxicities, gastritis, and gastric ulceration. Cats are extremely sensitive. So if we do use aspirin in cats for some reason, we're going to keep it to every other day type dosage regimens. And then if an animal that's been on aspirin is going to undergo surgery, we want to terminate that treatment a week prior to surgery because we're going to induce bleeding and we want to make sure that we can control the bleeding. So that is aspirin. We don't use it a whole lot, but we do have some very specific purposes for it still. Phenylbutazone, otherwise known as bute. This is used in the horse world pretty exclusively. It is good for sore muscles, tendons, ligaments, any pain related to performance horses. And then we also use it for laminitis. If you remember, I talked about laminitis back in the steroid section. And we don't use steroids to treat this kind of inflammation, but we do treat horses with it. And so laminitis, again, is inflammation of the lamina of the hoof. And in addition to treatment with bute, we'll also use it for, we'll also use therapeutic shoeing, typically to take the weight off the part of the hoof that is causing pain. There's a couple of really important adverse effects that can happen with bute. We do give it IV, and we can also send it home with owners to treat orally. But giving it IV, the veterinarian is going to be the one giving this drug. And the reason for that is this particular adverse effect, perivascular necrosis. Peri as in surrounding, vascular as in the blood vessels, and necrosis is in dead tissue. And what can happen is if this drug goes outside of the vein accidentally during administration, it can cause a severe necrotic reaction. So the tissue dies, we can have sloughing that's really, really awful and disturbing. So if you remember, when we give drugs IV, we put the needle into the vein, we make sure it's in the vein by pulling back on the plunger of the syringe to make sure we get blood in the barrel of the syringe. We give our drug. If we're giving a lot, we might stop and pull back again midway to make sure we're still in the vein, which is evidenced again by getting blood in that barrel of the syringe. Then we give the rest of it, and again at the end we check it. And in a drug like this, it's absolutely essential because if you go outside of the vein, you want to immediately infiltrate the area with some sterile saline to help prevent this necrosis that occurs. The veterinarian's most likely going to be giving this drug because they need to take responsibility for this particular side effect. And it may even violate their malpractice insurance if they're not the ones giving the injection. The other thing that occurs is bone marrow suppression. And this occurs in humans. It's occurred in humans who have chosen to take this drug. They might have been in the horse world and think, okay, it's good for horses. It'll be good for my aches and pains. But it can cause bone marrow suppression. And that is basically the reduction of production of red and white blood cells, which eventually leads to death because it's not compatible with life to not have red blood cells carrying oxygen around in your body. So we don't use it at all in food animals. It's not approved for food animals. Another thing I want to say about bute is that it is highly protein bound. And that's important, of course, in animals that might be hypoproteinemic. We'll want to reduce the dosage that we give them. But it's also an interesting property because it will, because of areas that have inflammation and are leaking fluids and proteins from the vessels in that area, from swelling and things like that, it will attract the phenylbutazone to the area and help with the treatment of that area. Another thing is that this drug does go through enterohepatic recirculation, so it does enhance the length of time that it treats the animal. Flunixin-meglumine is otherwise known as Banamine, and this can be used in horses and then other livestock. It is a more potent analgesic than phenylbutazone. So phenylbutazone is used to treat more mild type pain. But in the case of colic in horses, so this is potentially a colicking animal, they throw themselves on the ground, they kick at their belly, they are trying to get comfortable. And colic is a term that refers to abdominal pain. It can be from a variety of reasons, not just from the gastrointestinal tract. We can also use it just like with bute for musculoskeletal injuries. It is a fever reducer, and it's also used sometimes to treat mastitis or infection of the mammary gland in lactating animals. The interesting thing about flunixin-meglumine is it has an anti-endotoxic effect. When animals get an overgrowth of a particular bacteria in the gastrointestinal system, and this can occur from something they've ingested, it can occur sometimes from inappropriate drug use, antibiotics that shouldn't be used, and kill off one population of bacteria, leaving another population that produces endotoxins or toxins that are in the uh, intestinal tract. Those bacteria that proliferate can produce a toxin that then causes a life-threatening secretory diarrhea. The flunixin-meglumine tends to reduce the effects of that endotoxin. So we'll use it in those situations in horses, and we have used it sometimes in dogs, although in dogs it will be used only a couple of days at the most because of the potential for causing gastritis. Diclofenac sodium is otherwise known as Surpass, and this is a topical drug that is used in horses to treat musculoskeletal injuries and soreness, basically. It's used on the limbs, and the thing that you want owners to know is that using it on all four limbs and a lot of it can cause a potential toxicity. So we want to be careful in how much of this we're applying to the animal. It will penetrate the tissues. It'll last about 6 to 18 hours. So it can have a good long time, but sometimes it's just a short time. And then owners and we need to use drugs because it will also penetrate our tissues. There's a couple of ophthalmic or uses that we have for treating eyes with this drug. We use it for uveitis, similarly to aspirin, only this is directly applied to the eye. And we can use it in cataract surgery in dogs to reduce the inflammation that occurs there. And also it'll reduce inflammation when we have allergies and get that red eye, otherwise known as conjunctivitis.